What if one of the most important things you can do for your prostate takes less than a minute, and most men over 60 are doing the opposite every single day? Hello, gentlemen. I'm Dr. Catherine Hayes, a urologist with over 30 years of experience helping seasoned men maintain their sexual health and protect their quality of life. Here is a shocking truth. By the time most men reach 70, over 80% have an enlarged prostate. But here's the thing. I've seen men the same age with completely different outcomes. And in almost every case, the difference comes down to these small daily habits that we are going to be discussing about today. These habits are simple, practical, and surprisingly effective. Research shows that men who practice these 5 daily habits experience 70% fewer symptoms than those who do not. And today, I'm going to walk you through them one by one. Stick around until the last habit. It's the one that really makes a difference, starting tonight. Listen, your prostate has been working constantly for decades. By the time you hit 60, it's been producing fluid for 40 years, constantly dealing with hormonal changes, inflammation, and cellular stress every single day. That's why conditions like benign prostatic hyperplasia or prostate enlargement affect over 50% of men over 60 and rise to nearly 80% by 70. This causes a lot of issues. I see it a lot. Men waking up 5 to 6 times at night to urinate, struggling with a weak stream that takes forever to empty your bladder, feeling that constant urgency to urinate that makes you plan your life around bathroom stops. It becomes stressful and embarrassing. But here's the truth most people don't hear. This progression isn't inevitable. Research from Japan with nationwide analysis shows that with small, consistent daily habits, it's possible to protect your prostate, reduce symptoms, and even reclaim your nights. The 5 habits I'm sharing today target the actual mechanisms causing prostate damage: chronic inflammation, poor circulation, hormonal imbalance, cellular oxidation, and mechanical pressure. One patient of mine who is 68 was waking up to 6 times every night. He said, "I thought this was just aging and that there was nothing I could do." After focusing on these 5 habits for 3 months, he was down to just 1 nighttime trip. He told me, "I got my life back." Stories like his aren't rare. They're common when men make small, intentional choices. Now let's walk through them. I'll explain why each one matters, what I see in the clinic, and how you can make it part of your routine. If you are ready to protect your prostate, hit that like button and subscribe. Also share it with your friends, because many people don't get to hear this information, and that is what brings problems to them in later years. Okay now, habit number 5. Walk every day, even if it's just 30 minutes. Most men think walking is only about heart health. But in urology, we see something else. Men who walk consistently tend to have fewer prostate symptoms and slower progression of its enlargement. A 2024 study published in the British Journal of Sports Medicine tracked thousands of men. Those whose fitness improved by just 3% annually were 35% less likely to develop prostate cancer than men whose fitness declined. So, how does walking reduce your chances of prostate enlargement? To figure this out, I want you to picture what happens inside the body when you're not walking and exercising. Your blood flow slows, reducing the amount of oxygen your pelvic region gets, and waste from the cells starts to build up. Inflammation starts to build up because walking is directly linked to reducing chronic inflammation. You start to build fat around your pelvic region, and obesity directly accelerates prostate enlargement. Over time, those changes affect the prostate just like they affect the heart. Walking gently reverses that process. It improves blood flow through the pelvic region, and that matters more than most people realize. The prostate depends on steady circulation to maintain healthy tissue. When circulation improves, oxygen delivery improves, waste products clear more efficiently, and inflammation tends to settle down. Not intense workouts, not extreme training, just consistent movement. And in real life, I see this play out again and again. I had a patient in his late 60s who came in exhausted. He was waking up 5 times every night to urinate. He told me he had stopped traveling, stopped visiting friends, stopped enjoying evenings because he was always planning around a bathroom. We didn't start with medication. We started with a walk, 30 minutes a day. No gym, just consistency. 2 months later, he came back smiling. He had stopped waking up at night. His energy was better. He told me, I feel like my body is working with me again. That's what movement does. It helps your body regulate itself. Now here's the key. Intensity is less important than consistency. You don't have to power walk. You don't have to sweat heavily. You just need to move enough that your breathing deepens slightly and your body stays active. If 30 minutes at once feels like too much, break it up. 10 minutes in the morning, 10 minutes after lunch, 10 minutes in the evening. What matters is daily circulation. And I want to say something reassuring here. This isn't about discipline or perfection. It's about creating a habit your body can rely on. The prostate responds to stability. Regular movement sends a signal of balance. If you already walk daily, you're doing something very protective for your long-term health. If you don't, this is one of the simplest places to start. As helpful as walking is, the next habit affects the prostate even more directly, and most men never hear about it until symptoms begin. Habit number 4, be intentional about alcohol. This one surprises a lot of men. Many people believe that as long as drinking is moderate, it doesn't really affect the prostate. But after 60, the body processes alcohol differently, and the prostate becomes more sensitive to inflammation and hormonal shifts. Alcohol doesn't just pass through your system quietly. It affects circulation, it affects hormones, and it can irritate the bladder and prostate at the same time. What I often explain to patients is this: the prostate responds to balance. Alcohol pushes the body away from that balance. It increases inflammatory activity throughout the body, including in prostate tissue. It can disrupt hormone regulation, lowering testosterone and shifting the hormonal environment in a direction that encourages prostate growth. And for men who already have urinary symptoms, alcohol often makes urgency and frequency noticeably worse. I've seen this pattern many times in practice. One gentleman in his late 60s came to see me because he was waking up almost every hour at night. He assumed it was just aging. When we talked through his routine, he mentioned he drank several drinks every evening to relax. We simply reduced the amount and spaced it out throughout the week. Within about a month, his nighttime trips were cut in half. A few weeks later, his sleep was stable again. What surprised him most was not the improvement. It was how quickly his body responded once the irritation stopped. For most men over 60, moderation means something different than it did earlier in life. Think in terms of a weekly limit, not a daily habit. Spread drinks throughout the week rather than clustering them together. Ideally 3 to 4 drinks weekly. And give your body regular alcohol-free days to recover. It's about reducing a source of chronic irritation that quietly worsens symptoms over time. If you choose to drink, do it in a way your body can tolerate. If symptoms are already present, reducing alcohol is one of the fastest ways to notice improvement. And what's interesting is this: while alcohol reduction removes a source of irritation, the next habit actively supports the prostate's ability to heal and regulate itself. And that's where things start to change more dramatically. Habit number 3, include cooked tomatoes in your routine. This is one of the simplest habits on the list, and also one of the most overlooked. When we talk about prostate protection through diet, there's one specific nutrient that consistently shows up in research: lycopene. It's a powerful antioxidant that concentrates in prostate tissue and helps protect cells from long-term damage. And tomatoes are the richest common source. But here's the part many people don't realize. How you eat tomatoes matters just as much as how often. Raw tomatoes are healthy, of course, but when tomatoes are cooked, their cell structure breaks down. That process makes lycopene much easier for your body to absorb. In practical terms, your prostate gets more benefit from tomato sauce than from slices on a sandwich. What I usually tell patients is this: think of cooked tomatoes as supportive maintenance for prostate tissue. Just steady, protective support over time. In my clinic, I've had patients who were looking for complicated solutions, supplements, strict diets, expensive products, when often we start with simple nutritional consistency. One gentleman in his 70s decided to make a small change. Nothing extreme. He simply added tomato-based meals a few times a week and focused on consistent, balanced eating overall. At his follow-up months later, his health markers had improved and his symptoms were more stable. What stood out most to him was how manageable the change felt. No overhaul, just repetition of something simple. That's the pattern you want with habits like this. If you're thinking practically, This could look like tomato sauce with meals, roasted tomatoes with olive oil, tomato soup, marinara as a regular staple. When cooking the tomato, add a little bit of olive oil to increase its absorption. The goal isn't perfection, it's consistency. A few times each week is enough to create meaningful exposure over the long term. While nutrition protects the cells themselves, the next habit influences how the prostate functions day to day, and that's where many men notice the biggest relief in symptoms. Habit number 2, maintain a healthy weight, and if you're overweight, aim to lose about 10%. This isn't about appearance, it's about pressure, hormones, and inflammation, all of which directly affect the prostate. One thing I explain often in the clinic is that prostate problems rarely exist in isolation. They tend to show up alongside metabolic changes, increased abdominal fat, reduced activity, and long-term low-grade inflammation in the body. Belly fat is particularly important here. It's not just stored energy, it's biologically active tissue that produces inflammatory signals and alters hormone balance. It raises estrogen and insulin while suppressing testosterone. Over time, that environment can encourage prostate enlargement and worsen urinary symptoms. What's encouraging is how responsive the body can be to small changes. You don't need dramatic weight loss to see improvement. Losing even a small percentage of body weight can reduce inflammatory stress and improve how the urinary system functions day to day. I remember a patient in his early 60s who came in mainly because he was waking up repeatedly at night to urinate. He assumed it was simply aging. We focused on gradual weight reduction, nothing extreme, just consistent portion awareness and regular walking. Over several months, his weight decreased steadily, but what mattered most to him wasn't the number on the scale, it was that his sleep improved. Fewer interruptions during the night, less urgency to urinate, and more control of his bladder. That's usually what patients care about most. The practical approach is simple and sustainable. Reduce your food portions by 20 to 25%. Eat slowly, stopping before feeling overly full. Eat more whole foods, fewer highly processed ones. Consistent movement, like the daily walking we discussed earlier. When weight stabilizes in a healthier range, the prostate is operating in a calmer system. Less pressure, less inflammation, more balance. And that sets the stage for habit number 1 that has the most immediate impact for many men. The one that often changes nighttime symptoms the fastest. Habit number 1, don't ignore the urge to urinate. Go when your body tells you to. This sounds simple, but it's one of the most common habits I see causing unnecessary urinary problems in men over 60. A lot of men get used to delaying it, whether they are driving, in a meeting, or watching something, so they wait. Occasionally that's normal, but when it becomes routine, the bladder and prostate both feel the effects. Here's why. As the bladder continues to fill beyond comfort, it stretches and increases pressure in the area around the prostate. Over time, repeated overdistension can make the bladder muscle less efficient and can worsen symptoms like urgency, weak stream, and incomplete emptying. It's not usually one dramatic moment. It's the accumulation of small delays, repeated day after day. I had a patient in his mid-60s who worked long shifts where he ignored the urge for hours at a time. He came in mainly because of increasing urgency and difficulty emptying. Once he started responding to his body earlier instead of pushing through the urge, his symptoms gradually settled. That's the key idea here. Respect the signal. When you feel the need to go, treat it as information, not an inconvenience. A few practical ways to make this easier. Know where restrooms are when you're out. Take advantage of opportunities even if the urge is mild. If you'll be somewhere without access, plan fluids accordingly rather than holding for long stretches. Of all the habits we talked about, this one tends to improve daily comfort the fastest because it reduces strain on the entire urinary system in real time. Now, let me show you how to actually put these habits into practice in a simple, realistic way. Nothing complicated. Just small decisions you start today. Starting tonight, don't ignore the urge to urinate. When your body signals, respond to it. No pushing through. This one change alone reduces strain on the bladder and prostate. Tomorrow morning, begin with movement. Set aside 30 minutes for walking. It doesn't have to be fast. It doesn't have to be perfect. Just make it a daily appointment with yourself, something you don't cancel. At meals, Make one small adjustment. Reduce your portion slightly. A simple trick is using a smaller plate or stopping when you feel comfortably satisfied rather than completely full. If weight loss is needed, this gentle approach is far more sustainable than strict dieting. Take an honest look at alcohol. Track what you actually drink over a week. Then, aim to keep it modest and spaced out rather than habitual. Many men notice urinary symptoms improve within weeks just from this change. And lastly, this week, add cooked tomatoes to your meals. Tomato sauce, soup, roasted tomatoes, whatever you enjoy and will actually eat consistently. Now here's something I encourage my patients to do because it keeps motivation high. Pay attention to what changes. Before starting, notice how often you wake at night to urinate. Notice stream strength, urgency, comfort. Then simply observe what happens over the next few weeks as you follow the habits we have discussed. Most men begin to feel differences after 4 to 8 weeks. There are also a few broader habits that support everything we talked about. If you smoke, stopping is one of the most powerful health decisions you can make. Keep up with routine medical checkups. And don't underestimate stress. Chronic tension in the body often shows up in urinary symptoms. I remember one patient who committed to these changes step by step. Nothing extreme, just consistent. Over time, his symptoms eased, his sleep improved, and his daily life became easier again. What mattered wasn't intensity, it was consistency. That's really the message here. These habits aren't dramatic, they're not complicated, but practiced daily, they protect function, comfort, and quality of life in a very real way. None of these are complicated, but together, they create an environment where the prostate is far less likely to become symptomatic. If you want a place to start, begin with the simplest step. When your body tells you it's time to urinate, respond to it. Tomorrow, take a walk. This week, build in the other habits gradually. Over time, these small choices can protect comfort, sleep, and quality of life in very meaningful ways. If you found this helpful, let me know in the comments which habit stood out to you most. And if you'd like more practical guidance like this, subscribe. You're always welcome here. Take care of yourself, and I'll see you in the next video.